Happy Friday. Happy Friday, Dr. Munné.
Happy Friday, Adrian.
We have another session having coffee with Dr. Munné and great conversations and information about your dental health. So today we are connected and we are showing some samples, some patients, images, and implants and all. And we are going to show it to you on YouTube channel. So if you want to see those images and you're on TikTok, jump into Anna Munné DDS on Facebook or YouTube so you can see more about that. And well, without more to say, we will get into the topic of today with Dr. Munné, and we are going to continue talking about, we'll see dental implants. It was like
With dentures, yes.
implants with dentures. Let's get with Dr. Munné. She will get you all the good information about it. Thank you, Dr. Munné.
Thank you. Good morning, everyone, and thank you so much for tuning in also. Uh, we're going to continue talking about dental implants. We started that topic a couple of weeks ago, and we want to, continue expanding on it because I know there's a lot of interest on dental implants, and also because I think that dental implants are a technology and a solution that can help a lot of patients, and a lot of patients have been blessed with it. And I think that it can still bless a lot more, because out there I know there's a lot of patients that are very insecure about their smile. They're
Yes.
not happy about their dental condition. Maybe they know that they have teeth that they need to be extracted, they need to be removed. They might be feel a little embarrassed about their smile or maybe insecure, and that sometimes can cause issues with patients
Yeah.
socially, right? You don't
Yes.
feel confident at work, showing your smile. You always try to kind of smile a little bit, like covering your mouth, or maybe you don't feel comfortable eating in public, right? Or you might
Yeah.
have maybe a partial or something that is not secured sufficiently, or is ill fitting, it doesn't fit very well, and that causes patients to be uncomfortable, insecure, and in the back of your mind that you need to do something about it, and you
Yeah.
don't know what. And but you are aware, and this information for you is just to start developing also a map of what can dental implants offer, because I think it's a great solution for the patients that need it. Of course, the best thing is to get a good exam. Just make sure that you go to your dentist, or you find a dentist that's gonna be somebody that can do a good evaluation, and then exactly see where you're at. Sometimes in our mind we think that it's worse than it is, and maybe you only need to have one implant, maybe you don't need any. So you might think that things are terrible, and they might not be. Or but if they would be the case that all your teeth have to be removed, and it could be that maybe you don't have a lot of teeth left, or maybe you already don't have any teeth at this point and your dentures are not fitting comfortably, which we see that happens in many cases, right? That when a patient's wearing a denture, that denture has been wearing for several years, the bone keeps on dissolving, because the purpose of that bone is to hold teeth or to hold implants. If we don't have teeth or implants, the bone keeps on, we call resorbing, but means dissolving. So it keeps on becoming thinner and thinner and shorter and shorter. And at one point, the dentures don't hold up and you need a new denture, and then the same thing happens. And it gets to a point that it's hard to have anything hold up, because there's really nothing to sustain that denture. And we're all seeing patients that, they will have to remove their dentures, or they cannot eat with their dentures, or the dentures keep on falling. Sometimes they don't wear, especially the bottom. Very few patients get comfortable with the bottom denture, and that's a problem that happens very often. So the case that I want to show you today is the case of a patient that she came also very uncomfortable with her smile. She had a partial denture that was secure on 5 teeth, One of those five teeth broke because it was very decayed, and there was a lot of decay underneath the crowns on the remaining teeth to the point that those teeth could not be saved. So because of the tooth that broke, that is going to be on the left image that you have on your screen, on the left side of the left image, you'll see that there's a tooth that's broken, but also see that the bite was at an angle, so we call that a cant. We talked about that last week. There's a cant, but there's also a lot of bone loss on the top. The bone in the front was very behind, so it was behind the lower teeth, and it was very thin and receded. And you can see that the roots of the remaining teeth, they're kind of protruding because in between those already existing teeth, the missing teeth areas have the bone dissolved a lot considerably. So in this case, we had to do a combination. It was a combination. We did, of course, extractions, and we built up the bone in the top. And we did in the top a denture with implants, with 8 implants. The denture is secure, but in this case, we did what's called an FP2 case. And that means that we, instead of doing a denture that has the pink in there, the patient didn't want any pink. So we placed just porcelain. In this case, the teeth look a little longer, but that's called an FP2. That it's just kind of taking the room of that pink. But there is secure. There's 8 implants in there. We were able to actually rebuild a lot of
My
bone,
goodness, a lot.
and the patient's comfortable. Also observe on the bottom that the teeth now are straight. We were able to maintain the anterior teeth of the patient, and then we did some braces to straighten up the teeth. And then on the back of the lower areas of the lower jaw, the patient has implant bridges. So you can see that also we have straightened up the bite, and that's very important for the longevity and the success of the restoration. It's important that function, right? That the implants have the contacts, and the way that the jaw moves, that this is balanced in a way that is not going to be traumatic for the implants, because implants can fail because of the bite not being well adjusted, and that's one of the reasons why an implant can be lost. But if the bite is stable and is balanced, and if the patient has good home care, which means that there's no infection, those are the main two reasons why you can lose an implant. So if we do a lot of education in the office, the patients get educated on how to take care of themselves. And you can see, for instance, in this case, that this patient, she actually embraced on how to take care of her mouth. And that's marvelous to see, because a lot of times patients have failed because they have not had the proper information. So if the patient is educated and understands, a patient then wants to, of course, follow through with it. And you can see that there's the gums are very pink, and the patient is very comfortable. They know what to do, so she knows how to take care of herself. And of course, she maintains her regular cleanings. That this is the most important appointment, because that's the maintenance that's going to help you succeed over time. So just to summarize, this patient had full mouth implants on the top. That's a maxillary implant denture, but in this case, it's like an implant bridge, a fully supported implant bridge for all the tops. And then on the bottoms, we maintain the front teeth, and then we did implants on the back. Why do we like to maintain teeth if possible? Well, first of all, because, well, if the teeth are salvageable, there's no reason to remove them, number one. But number two, having the receptors that we have in the periodontal ligament, in the ligament that supports that tooth, actually helps a lot on preventing, because of course there's nothing better than teeth, right? So number one, teeth are always better than implants. So that's what God gave us.
That's right.
Definitely supersedes everything, and it's built in already with receptors that when we bite, the way we feel, the way our teeth touch, and then we release, we maintain, we call that proprioception. So by maintaining that proprioception, we also give more tools to the patient to be successful over time. And the patient does not have to lose those teeth the same way the patient does not have to lose those implants. Implants and teeth can be maintained forever if they're cleaned and they have no infection. So that's going to be basically keeping the teeth clean, making sure that there's not going to be bacteria causing decay or periodontal disease. And number two, maintaining a good level bite. And this patient also has a bite plate, so we make sure that all patients that have implants, they have a bite plate that they use at night to make sure that things are stable, and we just give a release and prevent the wear to increase the longevity of their dental work. And we're going to see now two more images, one right and one left, so we can observe a little bit more. Like on the right side, you see the broken tooth. You can see that the lower teeth actually had some were up and some were down. You can see that the plane of the bite was very uneven, or that was straightened up when we did the braces. And then you can see then everything just restored with the denture. And in this case, another interesting thing, and we can go look at the next view, um, Adrian. Here we actually see the left side of the patient. She had three teeth only. You can see that the back tooth also was very small, and it had a lot of decay on the distal, on the back part of the tooth. But this case actually initially was planned to be an implant denture, and the patient had decided that based on the financial investment, is less costly to do an implant denture sometimes than to do an implant bridge. But she, in the middle of the procedure, or in the middle of all this treatment plan, she had actually changed her mind. And we were able to make this happen because sometimes the planning that goes on how to place the implants is different. So, but we were able to make it work, and I was very happy because we always
Yes.
try to help patients and give the patient what the patient wants. Ultimately, that's her teeth, right? Her case, and we want to make sure that the patient is happy and feels fulfilled. And this is like a very, you know, um, long-term success where the patient has maintained it already for like about 7 years, and but the patient will continue because it's been very stable. And those are actually the after their photos that they were taken last week, and that the patient still
It's
continues
amazing.
well maintained and very healthy. Isn't that just such a
That
blessing?
is that is just amazing, just to be able to have your full mouth restored, through
Yes.
this procedure and have that safety. And I forgot to mention, Dr. Munné, but we discussed it on the previous one. But I remember, when I was 8 or 9 years old and seeing my grandma taking, her denture because she couldn't bite with it. So with this,
Yes.
you can.
Yeah, oh, absolutely. And a lot of patients have to remove their dentures in
Yeah.
order to eat because it's uncomfortable.
Yeah.
And that just tells us that there's two things, right? The denture doesn't hold up, so probably cannot even be functioning properly to
Yeah.
chew the food. And they're basically chewing with their gums. So you know that their diet is pretty bland, and also that makes for like a not very healthy diet, because the healthy diet is when we have vegetables and
Exactly.
crunchy foods,
They
right?
require your
And
teeth.
right, requires your teeth and that protein that we all need for our muscles and our bones, the
Yes.
building blocks. So we need to definitely to be able to chew on some meats or vegetables. And if you're a vegan, then you need definitely your veggies.
Yeah.
So it's important to maintain our teeth. And there's a lot of studies that show that patients that have their teeth, and in this case, if you have implants, it's like you restore your teeth, they actually live an average of at least 10 years more. So that tells you that having your teeth and proper nutrition really elongates your life a lot. And 10 years, I mean, I don't want to die
It
10
makes a
years
difference. 10
before.
years,
Yeah,
you
if they
get.
would tell you, well, you die now or you die 10 years from now, I would choose 10
I'll choose
years.
10 years. Why not an extension, right?
I would choose 10 years. So I think that anything, right? But definitely health is important. So that's also the purpose of those sessions, to help our community, help our listeners, to give you tools to be more successful at being healthy, because that's our
Yes,
goal.
that is correct. Thank you, Dr. Munné. Thank you guys for being connected today, and we try to get this information fresh from Dr. Munné's mind and experience on mouth health and all these areas that you are wondering and you might have questions. Do not forget to leave your comments below. Follow us. Stay tuned for upcoming lives. And all of this information is going to be, in little parts, so you can continue following up and seeing on all the different channels: TikTok, Instagram, YouTube, Facebook. Do not forget, if you have questions about our practice, please go ahead to Healthy Gums 4, number 4, healthygumsforall.com to know more about us and to know more about your dental health. We'll see you next time. Thank you, Dr. Munné.
Thank you, everyone, and please subscribe to our YouTube
That is
channel.
correct. We'll see you around.